My name's Dr. Ross Hauser. Welcome to the Hauser Neck Center. I'm here with the other prolotherapist that helps me run the Hauser Neck Center, Danielle Matias. Danielle, this is going to be part 2 of our series on headaches, tension headaches. One of the days, this was recently, I went actually over to the other building, which, you run. We call that building, Caring Medical Florida. And this building, the Hauser Neck Center, but it's the same company. But there was like 5 or 6 of our patients, in the waiting room, with their heads down. And there was this gal who had like this auburn, I think it was, shirt on, and she looked like maybe she was 19, college student. I hadn't recognized her, and she was here with one of her friends.
Okay.
That was a college student, and I looked at everybody, and of course when I walked in there, they're like, "Oh, the doctor's here." And I'm like, "Oh, I love to see this. Man, is my future going to be good, because you're all going to need more prolotherapy." And I talked to this 19-year-old, and I said to her in front of everybody, I go, "You got headaches, don't you?" And she goes, "How'd you know?" You know what I mean? Like, it's not benign. This is not benign. So all the college students, and I understand college, you got to study a lot and everything, but this is a progressive disorder, and tension headaches are by no means benign. So they seem like they're benign. Oh, I got some achiness here, whoop-de-doo. I take some ibuprofen. But tension headaches can be a sign that there's an underlying ligament problem, and ligament problems, as we all know, man, that can start affecting a lot of other structures. So here, this is the definition. Why don't you just talk about what is a tension headache?
So tension headaches, if you think about like kind of that muscle tightness, muscle tension, kind of on both sides of your head, and they are usually recurrent. They happen frequently or periodically, and they can be quick or they can last even days or longer. Typically, a tension headache is not one, like if you think about like a migraine where you get like nauseous and you might vomit and you're super sensitive to light, it's different than that. You don't usually have those symptoms with a tension headache.
There's a connotation that if you have tension headache, you just got some stress.
Sure.
And I kind of think of it as there's acute tension headache and chronic tension headache. Like I'm sure when the twins were in the hospital, you know what I mean? There are probably times where you woke up and just like you had so much tension in your neck.
Yeah.
But usually when somebody has chronic muscle tension where nothing is like relieving the tension in the neck, it probably is a sign there's an underlying ligament problem.
Sure, and everyone can have a stressful headache, that just comes and goes. It's really infrequent depending on your day or stress level. But you're right, like if you're getting headaches that are progressing, they're getting more frequent or coming all the time, and you've done all the muscle things, like you've gotten your massages, you've done dry needling and physical therapy and all the things.
Muscle relaxants.
Muscle relaxants, exactly. And you've done all the muscle appropriate treatments, but it's not helping, or it's only helping temporarily, then we got to dig deeper. Why are you getting this recurrent tension in your muscles? What are your muscles protecting? And why are they tightening?
Yeah, exactly. So this is one of our many figures that we've done to show that upper cervical instability or lower cervical instability can lead to so many different kind of symptoms, and one of the symptoms is basically headaches. So somebody who had tension headaches and they have other things going on, such as dizziness, such as vertigo, such as tinnitus, or if they've had other diagnoses plus you have tension headaches, you should think about maybe that there is some underlying ligamentous cervical instability. Like how would upper cervical instability lead to cervical dystonia or torticollis? And torticollis, where the neck twists or there's extra tension in the muscles. And many people do say they have a tension in the muscles, but sometimes the muscles grab. So why would the muscle grab?
Well, if you think about the anatomy. So you've got your vertebrae in your cervical spine, and if they're rotating or they're kind of twisting, well, in the front of your neck, you've got really important blood vessels and nerves. So if think about the vertebrae and they're twisting, rotating, your body's going to try to stop that, and it might just kind of, those muscles will just spasm and grab because it's trying to prevent that vertebrae from continuing to rotate and something bad happening.
I always think about the body is designed, the ligament, muscular, bony system is designed to protect the artery, the veins, and the nerves. So if the muscles are grabbing, it's exactly right. It's probably protecting and then basically these are a lot of the structures, the musculoskeletal and the ligamentous structures that are treated with prolotherapy.
If you have, let's say, anywhere from C1 or C0, I should say, C0 to C7 joint instability, and all those muscles, like big and small, are spasming, trying to protect your nerves and your blood vessels and prevent those bones from moving, if you can actually, like prolotherapy, strengthen those ligaments and really like restabilize that neck as a whole, your muscles aren't going to have to work as hard. They're not going to have to protect the bones, protect the nerves and the blood vessels from the bones, because the bones are going to be stable and in a proper position. They're not going to be a threat, so to speak, to those blood vessels and nerves.
I've had some patients recently, and a lot of times it's typically guys versus gals who got terrible curve, people don't know, like if you look at your cell phone for hours and hours, you don't realize your neck curve could just be terrible, like this instead of like this. And we do a digital motion x-ray and it actually doesn't show instability, but the person has chronic muscle tension. So you and I would say, well, the person actually has one of two options. We could do a exercise program, do weights to try to get them, because some people, there's so much arthritis, you're never going to get them with a curve, but you might get them straight. But sometimes we elect to go ahead with prolotherapy because it's unbelievable, because you've seen this too. Like even if, for instance, like say somebody they have so much arthritis in their neck, just the bones are almost fused, but still these muscle attachments can be painful.
Totally.
So we typically use prolotherapy to resolve joint instability, but you also can get rid of pain. That's where the ligament, where the muscles or the tendons attach to the bones. So that's where for tension, muscular tension headaches, you may do prolotherapy even if joint instability is not present. And then this is a good illustration of, let's be honest, what's probably causing most people's tension headaches, right? So how would you describe this?
Well, I think this picture describes a lot of people. It's not a big force necessarily just looking down at your computer or looking down at your phone, but if you do that small force for hours every day, your phone will tell you actually how many hours you're on your phone a day. Maybe it's like 5 hours, plus you have a computer job, so it just adds up. These ligaments here, these are the capsular ligaments specifically, will just slowly stretch over time and can actually develop into joint instability.
Yeah. And I think you've heard me say that I had a counselor who works at one of the high schools in St. Pete, and she said, this is in a high school then, she said whenever the kids come in, and she helps them decide what career path to go in, vocational counselor, I guess. And then she always has the kids give them their cell phone. And she said every kid, 100% of the kids are addicted to their cell phone. And every kid, the screen time is between 10 to 14 hours a day. So that means the kids in school are actually texting and everything. So if you have a child who's already having clicking, popping, grinding in their neck or tension in their neck, I would really, really encourage you to have your child get a lateral x-ray, because again, if their curve is already like this, it's going to be really, really bad for them in the future of getting not just tension headaches, but migraine headaches and intracranial hypertension, a lot of other things that we'll talk about on this. It's actually very, very serious, and especially if the teenager isn't of their right mind, like they're just not acting correctly, like they're anxious, they're angry, it could be that their brain pressure is really high because of the change of the cervical curve. And again, if you get upper cervical or lower cervical ligament damage, you can get all these things. You can get muscle spasms, you can get all kinds of vascular problems, and it can again affect the drainage of the brain, which leads to increased brain pressure. And then besides just tension in the muscles, you end up having head pressure. Cervical instability can give every type of headache, because isn't it true, you usually typically don't have somebody who says to you, I just got muscle tension headache, isn't it? It seems like they have like 2 or 3 different kinds of headaches. So that would make one think that there probably is something underlying that's causing all the different kinds of headaches.
Sure.
And then by migraine headache, we mean like a pulsatile type of headache. And like you had said, that the person has to lay down in a dark room. And then tension headaches also, though, they're often helped by laying down. And why is that?
Well, one, when you lay down, you're actually, what should happen is you kind of almost more like create your lordotic curve, and those muscles can relax a little bit, and they don't have to support you in an upright position.
Yep, exactly. And then this just kind of explains, especially if somebody has a lot of tension up here. So I kind of think about there's 2 types of tension headaches, if you will. The one person says, I'm just telling you it's always tight here. That normally relates to upper cervical instability. And then, of course, with the excessive kyphotic posture of the thoracic spine. So sometimes from a prolotherapy standpoint, we have to treat the lower cervical and then the upper thoracic.
A lot of times people with this, they'll say it's just right here. They'll like do this with their hands. Like it's just this band at the base of my skull. And these muscles, they really aren't that big, but I mean, they're like powerhouse muscles. If they're tight and they all, spasm in conjuncture, that can be pretty debilitating.
So this is part of our digital motion x-ray. So the person's neutral here, then here they go like this. Because think about how many hours somebody goes like this. So you see that the C1 space, so the C1 nerve is going to come out here, and the C1 nerve, that is one of the nerves that innervates the muscles here. So that's one reason why people get muscle tension here. The C1 nerve innervates part of the dura, which covers the brain. And then when the C1 nerve there gets pinched or compressed, the pain referral is around the eyes. There's just a lot of people that just feel eye pressure or pain around the eye that sometimes gets diagnosed as migraine, but it actually isn't a migraine. It's instability up here and a decrease in the C1 space.
This kind of reminds me of somebody that potentially, like this could be someone that they wake up, and if they slept in a good position, they wake up and they feel fine, and then they're working on their computer all day, like in this position, or they slowly get in this position, and then by the end of the workday, they'll have a headache, or their eye will hurt, and they might think like it's their computer. Maybe I need different glasses because I'm looking at a computer screen, or that's what's causing my headaches, which really, like if this is what's happening all day, is they're just pressing on that C1 nerve.
And the C1 nerve follows the distribution of the vertebral arteries. So if this is happening to the C1 nerve, it's possibly intermittently that the vertebral artery is getting compressed, and that gives you like an awful feeling, nausea, dizziness. You don't feel like yourself.
You don't feel good.
And then this is honestly one of the main treatments, which is just making sure that your computer height, this is a patient of ours, that we helped her like keep raising, and then see how that's the kind of chair that I have right over there, which is a kneeling rocker bottom chair. So to use the computer with this chair, you have to be having your chest forward, otherwise you're gonna go forward. So I'd really encourage people that their workstation has to be correct, because if your workstation is correct, you're going to be strengthening the core muscles, the neck muscles. You'll have your cervical lordotic curve, so you'll actually be helping your neck, helping your tension headaches. Hopefully then, if you did get prolotherapy, then you're gonna stay well because your anatomy is gonna be correct.
Yeah, just a couple things to point out is if you look at her neck, kind of on the last screen, there's a difference between looking up and then like slouching forward and looking up. Like this is what would compress your nerve, where just like, kind of looking up a little bit actually will just probably benefit your curve a little bit and give you better blood flow in and out of your brain. And then here, even if you think about your low back for a second, sitting like this versus slouching is just gonna really be better kind of for your whole body, or better mechanics in general overall.
A common question people ask me is, well, what exercises can I do? And I'm almost hesitant to give them exercise because all I want people to do is stop looking down,
Yeah.
like stop the face down lifestyle and just do a face up lifestyle. Because if we just did this, because most of us, we spend our time doing something, and most of us, we have to deal with the computer,
Yeah.
or we're all day long with the cell phone, like say somebody's a mother and the kids are at daycare, so if we just figured out ways in our lifestyle where we're just looking up, that's going to be enough to correct your cervical curve. Well, thank you guys so much for watching, and we look forward to doing part 3 of our series on headaches.
Thank you.